The reason that we want people to connect to treatment so early for opioid use disorder, or really for all substance use disorders, is that there's a real risk of bad outcomes when you're misusing substances, especially opiates. And the scariest risk that we read about all the time in the newspaper, of course, is death. And so even those that are experimenting are at risk for accidentally overdosing. And that's certainly not anything that anyone wants. And so the sooner you're able to connect with a provider that can connect you with harm reduction strategies, as well as offer the medications and treatments for opioid use disorder, the better one is. So when one's overdosing from opiates, basically everything sort of slows down in the body. Your breathing slows down, your heart rate slows down, you can see people turning blue. I think the challenge is that when one's overdosing, at times there are often a lot of substances on board and it's hard to pinpoint things. And so when we're training individuals with opiate misuse or family members to have this naloxone rescue kit, which you give to people when they're at overdosing, we encourage them not to be detectives overall. And the big thing is if you see someone overdosing, not responding, to immediately call 911 and give the naloxone and not play detective, because the bottom line is that the sooner you intervene, the better chance this person has to survive. And so we do recommend just intervening as soon as possible. Naloxone rescue kits are available in most states in the United States, often for free. And the Surgeon General, in fact, has argued that everyone should carry a naloxone rescue kit in the setting of the opiate epidemic. And so these days you can pretty much get them anywhere. Ask your doctor, he can give you a prescription. In some states you can actually go to a pharmacy without a prescription to pick up the naloxone rescue kits. And there's actually this push down the line that it'll be available over the counter as well.